Good afternoon, everyone. Thank you for joining us for a COVID-19 media update here at CDPHE. We're going to have a couple of presenters and then we'll have a media Q&A here at the end of our meeting. A couple of housekeeping notes. We have two translation options that you can access there at the bottom of your Zoom console. We do have a Spanish language translation channel and an American Sign Language translation channel. You can use that gray slider bar in the middle of your screen to customize your view a little bit between the presentation slides and the speaker. So we're going to go ahead and get things started. And we're going to, today, we're going to have Director Scott Bookman, our COVID-19 Incident Commander, and Dr. Rachel Herlihy, our state epidemiologist. And to start things off, we'll get a case update from Dr. Herlihy.
Great, thank you so much, and good afternoon to all of you. Thank you for joining us. So I want to start here with a quick update on our trends in the state, and then we'll also talk a little bit about the Omicron variant and what we're learning so far. So taking a look at our case trends, this figure shows you our case trends over time. Each of those gray vertical bars shows you daily case counts in the state, and then the red line is showing you our 7-day moving average trend. So what you'll see if you take a look at the last couple of weeks worth of data is that we were seeing a steady decline in cases. Then came the Thanksgiving holiday. Following that, we saw a little bit of a rebound in cases, and now we're once again seeing a steady decline in cases in the state. The reason for that rebound, there's probably two primary reasons we see that. One, we believe that there's probably some level of under detection that occurs over holidays. So that's part of the reason that we see an overall decrease in cases around holidays. And then we also know that during holiday times, people gather in different ways, people have new contacts, and that can potentially result in a burst of transmission. We've seen this with previous holidays. And so as part of that increase we saw following the holiday may be due to some of that transmission that occurs during holiday gatherings. But the good news, of course, is that at this point, we are continuing to see a new downward trend in cases. I would also add that this is actually in contrast to what we're seeing in the U.S. overall. If you look at the overall U.S. trends, the U.S. trends are actually showing an increasing trend in cases right now. Next slide, please. So this next slide shows you our percent positivity data. So this shows you data for the percentage of our PCR tests that are performed in the state that come back positive. You'll see that the current value, the 7-day average value for percent positivity is 7.64. This is another way for us to track trends in the state. So you can see in this same data that we see a very similar trend where we had a slight rebound following Thanksgiving, and now this clear downward trend once again. Our goal, of course, is to try and get below that 5% mark as an indicator we have sufficient testing occurring in the state to have a full picture of transmission that's happening. Next slide, please. And then finally, just a few updates from me on the Omicron variant. So I want to share with you what we know so far and what we don't know at this point. First thing I want to say is that Colorado still has just 2 reported cases of the Omicron variant. We haven't detected additional cases since those 2 that have been reported on. So South Africa has reported that they are seeing Omicron growing faster than Delta did in that country. But at this point, it's not fully clear if that increased growth that is being experienced with Omicron is due more to inherent features of the virus, increased transmissibility of the virus, or more due to human features. So things like the immune response factors that individuals have. So one of the things that is being seen related to those human immune response features is that reinfection does appear to be more common with Omicron than it was with Delta or the Beta variants. This is something that South Africa is reporting. And it also looks like we are seeing some level of impact to vaccine effectiveness associated with Omicron, though Pfizer is reporting that they are seeing in laboratory studies protected antibody levels from people who have received boosters. So again, a really important reminder of the importance of booster doses to ensure that individuals are protected as much as possible against Omicron or against Delta, which is obviously the variant that's most commonly circulating here in Colorado right now. Still lots of remaining questions around severity of the Omicron variant. There is some early reassuring data coming out of South Africa, but the World Health Organization is also cautioning interpretation of that data, not knowing yet if it's a full picture of all age groups and demographics who may be potentially at risk of this infection. So one of the things they have noted is that a large number of the early infections were among travelers or younger healthy people. And so it's difficult to know whether severity is the same or less with this variant compared to Delta and previous variants. So still more to learn there, but so far it does look like there is some preliminary data that is a little bit more reassuring. And then I'll turn it over to Director Bookman. Thank you.
Thank you, Dr. Hurley, and thanks everybody for joining today. Quick update on hospitalizations. We are now at 1,356 people hospitalized with COVID in the state of Colorado. We have started to come down from our peak earlier this month. And while the overall trend is very positive for cases, percent positivity, and hospitalizations, I do want to stress that we still have a lot of people in the hospital in Colorado with COVID. Our healthcare workers, our EMS providers, our first responders on the front lines are still working around the clock, nights, weekends, holidays, to take care of a lot of people with COVID. And we'll talk in a bit about what we can do to continue to bring these COVID hospitalizations down. But I do just want to remind everybody that while we are heading in the right direction, we have a long way to go until our hospitals start to empty out. Next slide, please. As we've shown you this slide before, we show it again today where we see those blue bars looking at the number of hospitalized patients with COVID each day. And then the orange line tells us the 7-day moving average of our total beds available. Again, like to reference December 1st of 2020, when we had 1,851 people hospitalized with COVID in the state of Colorado and had an additional 1,800 hospital beds available. Today, we have 1,356 people hospitalized with COVID and only have about 518 hospital beds available. And so we continue to see stress on our healthcare system. We continue to see hospitalizations from COVID and non-COVID as well, and really want to make sure that all Coloradans are aware of where our healthcare system is today. Next slide. I'm going to give a quick update on where we are on our vaccination efforts. First of all, so grateful that our 5 to 11-year-olds are now able to be vaccinated. Our 10-year-old has now had the opportunity to receive both doses of the Pfizer vaccine. Very excited about that. Colorado is doing an incredible job and vaccinating this population. 115,000 5 to 11-year-olds have been vaccinated. That's 24% of our eligible population. That compares to the CDC national rate, which is only 17.6% of the population. It is also becoming clearer and clearer how important booster doses are. And more than 1 million Coloradans have received a booster dose. That's 42.9% of those who are eligible. We need to get more Coloradans to get their booster. Here's what we know. People who have received a booster dose are 2.4 times less likely to get infected with COVID-19. They're 9.7 times less likely to get infected than those who haven't been vaccinated at all. And they are 47.5 times less likely to be hospitalized with COVID than people who haven't been vaccinated at all. The case is clear. There is no doubt how important these booster shots are. And we really want to encourage all Coloradans to make sure that if you are eligible, if you are more than 6 months out from your second dose of an mRNA vaccine, or more than 2 months out from your dose of J&J, that you're going and getting your booster shot. Next slide. So since we're down to 5 and up being eligible for vaccine at this point, we really want to make sure that the whole family has an opportunity to get vaccinated together. Get your 5 to 11-year-old vaccinated, get your booster while you're there, and do it as soon as possible so that you have the highest levels of protection before the holidays. We have large community sites offering up to 1,000 doses each day, Friday, Saturday, and Sunday, so it's easily accessible for children. These sites do offer vaccines for all Coloradans age 5 and up. This is at the Aurora Municipal Center. It's at the Chapel Hills Mall in Colorado Springs, the Douglas County Fairgrounds, and the Pueblo Mall. There are 1,800 registered COVID providers in the state. You can find a provider near you going to our website and going to the Vaccine Finder page. Next slide. So we are in the midst of the holiday season. And this holiday season has an opportunity to look significantly different than the holidays looked last year. And so first and foremost, as you think about planning your parties, let's have gatherings where everybody 5 and up has been vaccinated. If you have people who are attending who have not been vaccinated, they should have a negative COVID test within 72 hours of attending that holiday party, whether it's a personal party or whether it's at work. Certainly want to consider requiring proof of vaccination or proof of a recent negative test. If you're not feeling well, please stay home. If you have symptoms of COVID, if you're positive for COVID, or you've had close contact with somebody who was recently diagnosed with COVID, please stay home. If you are hosting a party, think about hosting smaller, shorter outdoor gatherings, open windows, and improve your ventilation if you're going to be indoors. And keep a list of guests and their contact information in case somebody is test positive for COVID. Makes it much easier to do case investigation and contact tracing. People who get testivated or could get tested. And we really do want to encourage people to activate the free anonymous exposure notification service as well. Next slide. And part of this preparation for the holidays, part of being safe all the time, is having easy access to at-home tests. Colorado is distributing free, rapid COVID-19 over-the-counter tests directly to people's homes. This uses the Abbott Binax test, which gives you results within 15 minutes. And so this is a great way, a free way for people to do testing in the privacy of their home, know what their status is. You can use these tests if you're not feeling well. You can certainly use these tests before holiday gatherings to make sure that we are reducing and minimizing the spread of COVID-19. And so more information on our at-home testing program is also available on our website. Next slide. All right, Brian, I'll turn it back over to you.
Thank you, Director Bookman. That's going to conclude this portion of our presentation. We'll open things up for a media Q&A portion of this afternoon's meeting. We'll use the raise hand function. You can raise your hand and we'll get to you in the order that those requests were received. Let's stick with first questions first. If we do have time towards the end, we can come back around for some follow-ups or some second questions. Please state your name and your outlet before asking your question. And do note that we can be reached at media_info@state.co.us for any inquiries that we're not able to address during today's press conference. Let's go ahead and start with Meg Wingerter.
Hello, this is Meg Wingerter from the Denver Post. I wanted to ask, so the last few days, the hospitalizations look kind of plateaued after they had been falling for a bit. Do you think that's just that little bump we saw in cases and that should start going down consistently in the near future, or how do you interpret that?
Yeah, this is Rachel. I can take that question. So you're right. We did see a little bit of an increase in hospitalizations over the weekend, but numbers have come down for several days now since then. So I think that is reassuring. As I mentioned with cases, we did see that same trend in cases where we saw a decrease in cases following Thanksgiving, followed by a short increase and now a decrease again. And I think it comes back to those two factors that I described. With hospitalizations, though, we think it's probably more likely to be individuals who perhaps gathered and had higher rates of exposure over the holiday, and potentially that resulted in more cases and more hospitalizations occurring. And then now that we've gotten back into our more normal routine, normal contacts occurring, we're seeing those cases drop off again.
All right, let's go to John Ingold.
Hey everyone, it's John from the Sun. So question on the case trends, if they end up holding, and hopefully they will, it'll look almost exactly like last year's curve did for that spike. And and also turning around at more or less the exact same time. And so I'm wondering, do we have any indication of what's happening there? Well, what happens right around December 1st in Colorado that seems to be helping to reverse these big case surges?
Yeah, I think it's a really interesting observation that, almost to the day, the trends are following each other from last year compared to this year. I think it's potentially two different things. One could be, changes in weather in the state. And we know that the case trends that we've seen here in Colorado have been similar to case trends that we've seen in some of our neighboring states. So some of it could be temperature, humidity changes. The other factor also is that human behavior could change at a certain time of the year. And that's the same this year as it was last year. So people move indoors, activities change. We also know that as time goes on with these waves of illness, what leads to these waves of illness often going down are changes in transmission control. And some of that can be due to levels of immunity changing in our overall population. And so as there's fewer susceptible individuals, there's fewer infections that are remaining to occur. So I think it's probably a variety of factors. I think lots of questions still remain about what precisely drives these waves of illness. And I think it's a question that scientists are going to be studying for many years to come.
Let's go to Chris Vanderveen. Go ahead, Chris.
Chris Vanderveen with 9 News. It looks as if when it comes to your hospitalizations, the admissions are going down at a fairly steady clip over the last couple of weeks, but discharges haven't been as quick to sort of go down. In addition, we still have been fluctuating anywhere from like 70 to 90 available ICU beds at any given time. Is there any indication that patients are staying longer in the hospital, that we're seeing any more severity in the hospital that's causing people to stay a little longer? So you see the decrease in admissions, but you're not seeing the decrease in discharges. Hopefully that question makes sense.
Yeah, I can talk a little bit about that. So we haven't seen substantial changes in average hospital length of stay. One thing we do see a difference in, though, is the average length of stay for hospitalization that occurs among a vaccinated person versus unvaccinated person. We do tend to see that the hospitalization length of stay for individuals that have been previously vaccinated does tend to be shorter than individuals who are unvaccinated. I would also say that one of the things that can happen with hospitalization data is it can be fairly skewed. So there are going to be a smaller number of very long hospitalizations. So these are really the most critically ill patients. And so as we start to see admissions decrease as transmission is decreasing, those short hospital stays sort of turn over very quickly, but we still have a number of patients who are quite ill, and those can tend to be our ICU patients that unfortunately might be in the hospital for many weeks to come.
Okay, let's go to Kevin Larson. Go ahead.
Hi, guys. Kevin Larson with 9 News. In regards to the Adelante Clinic being canceled last Saturday because the state didn't have enough vaccinators to attend the clinic, the organizers told us that they had lined up some vaccinators to kind of fill the gap, but we're told by the state that there wasn't enough time to verify their credentials. We were wondering if the state has the capacity to, or if the state has looked into possibly getting like a list of vaccinators, backup vaccinators lined up, have people kind of submit their information to be in reserves so that they can be ready to go if a clinic is has a chance of being canceled at some point.
Thanks, Kevin. I'll take that one. First, I really do just want to, thank Adelante. They've been a great partner over the last 10 months. We've done 23 clinics with them and have vaccinated more than 7,700 people. There is a national staffing crisis right now, as we know, and that impacts all sectors, and that includes our teams. And so we are doing all that we can to increase the staffing contracts that we have available. We, move resources around whenever that we can. From time to time, unfortunately, cancellations do happen. We do have the Colorado Volunteer Mobilizer, which is a place where volunteers can sign up to participate in clinics with us. This volunteer mobilizer allows us to verify the credentials of people, ensure that they are safe to be working in these clinics. This is a medical procedure, and we need to make sure that the people who are participating in this are qualified to do so.
Let's go to Claire Cleveland.
Hi, Claire Cleveland, Colorado Public Radio. I actually just had a question that's kind of clarifying from the governor's press conference. Dr. Herlihy, can you tell me when Omicron was detected in Boulder's wastewater?
Yes, I believe the specimen was collected on the 2nd of December. So the sequencing would have taken several days after that, but the 2nd was the date it was collected.
Okay, thank you.
All right, let's go to Jason Grunauer.
Hi, Jason Grunauer, Denver 7. I wanted to ask a little bit more about this under detection around the holidays. Does that mean that as we get closer to Christmas, we shouldn't be putting as much emphasis on the numbers that we're seeing? And then also, does that also mean that a few days after, if we do see a bit of a larger spike, that is not something that people should kind of really worry about because it's just people getting back in and getting tested?
Yes, so I would say definitely important to interpret the case data and the percent positivity data with caution around holidays, especially longer holiday weekends. And that's because of a number of reasons. We know that individuals might be less likely to choose to go get tested on those holiday weekends. We know that some places might be closed or some locations might have shorter hours, some staffing limitations as well. So facilities might have skeleton crews working. So I think there's a variety of things that can happen around holidays that result in fewer cases potentially being reported. So again, that could be one of the reasons that we see a dip in cases followed by an increase in cases. The second reason could be that around holidays, individuals gather in larger groups than they typically do on a normal weekend, or they gather with more people or in larger groups. So I think all of those things can really combine to sort of have create this picture where it's difficult to interpret some of the data. I expect we could potentially see the same thing following Christmas and New Year's, where we'll have this extended period of time following the holidays where it's difficult to precisely interpret the data. One of the things that I would say that tends to be a little bit more reliable around the time of holidays, though, is some of the hospitalization data. I think that data is much less likely to be biased. Individuals that require higher level of care will still seek that care and be hospitalized. So I don't think there's the same sort of testing bias that we see with case type data.
All right, let's go to Seth Kleiman.
Hey, Seth from the Gazette. So if I'm reading, Scott, your graph about capacity correctly, even as hospitalizations from COVID have improved over the last 3 weeks and the state has surged staff and beds, it still looks like we're at the tightest point as far as capacity goes. So what's driving that, even as you've added beds and staffing, and what's your level of concern of hospital capacity being hit for factors outside of COVID? Thanks.
Thanks, Seth. The pandemic has had an impact on people's health, full stop. People have been concerned about going to see their doctor, about going to the hospital. They have delayed care. And so what we're seeing now is a backup in the care that people have received. And so surgeries are being rescheduled. People who, didn't go get their colonoscopy are getting diagnosed with later stage cancers now, and they're catching up with this. And so, we are carefully watching the capacity of our healthcare system. We're working with our partners at the Colorado Hospital Association and our combined hospital transfer center to ensure that we have the ability to move people from areas of higher volume to areas of lower volume as needed. We continue to monitor these metrics very, very closely. And we're really grateful to all the work that our healthcare providers have done over the last 2 years. And to the public, I really just want to say it is safe to go to the hospital. It is safe to go see your doctor. Please do not cancel appointments. Do not delay your care. to make sure that you stay up to date and get your flu shot. We really want to make sure that everybody is getting their flu shot as well.
All right, let's go to John Ingold.
Oh, sorry. I think Meg might be ahead of me in the queue for second questions.
I apologize, John. I had not written down that we had gotten to you already. Go ahead, Meg.
Hi, this is Meg Post again. I saw about the nationwide new vaccinations for that 5 to 11 age group seem to be slowing down. Are we seeing that yet in Colorado?
I think it's a little early to say whether we're truly seeing a slowing. Obviously, we saw a big uptake in the very beginning where early adopters were very eager to go get their vaccine. We have seen this in every phase of our vaccination efforts where those who are really excited to go get the vaccine get it first. We then kind of work our way through the kind of middle part of our population. And then really continue to work our way, to those who are significantly more hesitant. But we are well ahead of the national average. We are continuing to hold these events at locations that are fun and accessible for this particular population. We're really, really thankful to all of our partners who have done this work with us, and also very excited to say that the Pfizer vaccine has now been authorized for boosters for our 16 and 17-year-olds. So another part of our population who are now eligible to get improved protection from this vaccine.
All right, let's go back to John Ingold.
Yeah, thanks, Brian. Just very quick question on that last point from Scott. 16 and 17-year-olds they're good to now go to the clinics and get their boosters. No other action is needed by the state or anything like that.
Nope, they will be eligible to go get this. Obviously, they still need to be more than 6 months out from their second dose, right? So it's not every 16 and 17-year-old. We need to have been at that 6-month mark. But this announcement just came out from the CDC today.
All right, thank you, everyone. That will wrap up today's press conference. If you have any additional questions or anything on topics that we were not able to cover this afternoon, please email us at media_info@state.co.us. We appreciate you joining us this afternoon. Have a good rest of your day.